Hi, my name is Jessie Borelli, and I'm a clinical psychologist and a faculty member at University of California, Irvine.
Hi, my name is Brianna Cervantes, and I'm also at the University of California, Irvine.
And we're here today to talk to you about our research study that involves the process of implementing an attachment-based family intervention at a community health organization called Latino Health Access. The premise of our study was based on trying to understand the process of collaboration of intervention researchers trying to implement an intervention within a community organization. And we wanted to do this because community academic partnerships are difficult and often fail. One reason for this is because researchers come into community-based organizations trying to impose their academic knowledge upon community partners, often without sufficient regard or respect for the knowledge, traditions, practices, and needs of their community partner. Recognition of this fact has led many researchers to develop partnerships with community agencies early on so that they can develop interventions from the ground up within agencies, operating with partners as a way to build more sustainable intervention programs that are more likely to last and will be more efficacious in the long run. However, these partnerships are also rife with challenges.
So in the current study, we describe and analyze our experiences co-developing an attachment-based intervention that was designed to be delivered by promotores or community-led health workers to low-income Latino mothers and youth within a group therapy context. The premise of the study is that by evaluating the process of collaboration and co-designing intervention, we can learn about the process and extrapolate lessons that will be useful for similar groups seeking to partner researchers and community agencies for the purpose of co-creating interventions. Unique to our study is that we analyze the perspectives of all members of the collaborative process. On the community agency side, we analyze the perspectives of the promotores and the administration personnel. And then on the university research side, we analyze the perspectives of student research coordinators, as well as the university principal investigator.
In order to answer our research question, we conducted a qualitative analysis of the semi-structured interviews and written questionnaire responses. These responses were delivered in both English and Spanish, and we extracted themes from these interviews and questionnaires. We focus on challenges and opportunities that the collaboration unveiled. Our findings revealed that members of this collaboration identified barriers and solutions that could be broadly categorized as being both structural or cognitive-affective in nature. The findings were largely consistent with what has been discussed in the previous literature. In addition, we found interesting differences in how these barriers and solutions were perceived as a function of the role that members of the collaboration had. For instance, the perceived barriers and solutions identified by an administrator level person, like a university principal investigator, differed from those identified by an on-the-ground person, like a promotora.
So our findings reveal that as is important in any successful partnership, it's crucial to recognize the strengths that each party brings to the table. In the context of community academic partnerships, the strengths of such collaborations to address the need for culturally relevant, accessible mental health programs are well documented. The current study also highlights the value of bringing a strengths-based mindset to the collaboration process. And our work also reiterates the importance of ensuring that there's open communication among all stakeholders, allowing for several opportunities for members to provide feedback about both the development and implementation process. Finally, at all stages of the research, we encourage future researchers engaging in such community academic partnerships to practice cultural humility and posture themselves in a position that seeks to better understand the history in which community stakeholders have traditionally been mistreated and acknowledges the potential power imbalance that may exist within these type of partnerships.
Thank you for listening, and if you want to learn more, please read our article.